What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. In this video today, I'm going to be talking about an injury that one of the Blazers players had about a week ago. I'm sorry I'm late to finally getting around to make a video about this, but I just wanted to explain his injury and what we as orthopedic surgeons would do for this type of injury. For those who are new to the channel, my name is Dr. Antonio Webb, a fifth-year orthopedic surgery resident. So, if you watch the videos and if you look at this picture right here, you will notice that Jusuf Nurkic came down upon his leg and had an obvious deformity to his leg. Whenever there is an injury to that particular portion of the leg, it could be a number of different things. And we as orthopedic surgeons would see this patient in the ER or on the field in clinic and then would obtain x-rays to see what is going on with the leg. So there have been other injuries that have fracture dislocations, which means the bone is broken and also the bone is out of place. This is just an example of an ankle here. I don't have the full tibia, but you can see the bone called the talus here. There's other bones in the foot here, and this is the calcaneus. When the tibia and the talus are dislocated or they're out of place, that is called an ankle fracture dislocation. And there's lots of different types. There's and lots of different treatments for those injuries, and it depends on what type of fracture that you have. Jusuf Nurkic had a compound fracture, which means that there was a piece of bone that was poking through the skin. And it's usually the tibia. The tibia sits here, and then it pokes through the skin, and it's called a compound fracture. Whenever there is an open fracture, that is more of a surgical emergency for us as orthopedic surgeons due to the risk of infection. Whenever there is a bone sticking out of the skin, we most likely would take this patient to the operating room sooner than later to wash out the areas of the bone that is exposed and also fix the bone. So once the bone is identified in the field, or if you're at the game and you see a piece of bone sticking out of the leg, most of us would try to reduce the fracture. There's a lot of adrenaline going on from the game, and the best thing to most likely do is to get that bone back in an appropriate position where it is not sticking out of the skin. A lot of times the EMS workers will put it into an air cast or to a boot or some type of traction and then let the orthopedic surgeons do this in the emergency room. Once the patient comes to the emergency room, we give him medication to make him a little sedated, and then we reduce the fracture, which means we put the bones back in an anatomic alignment. This means usually entails several people kind of pulling on the ankle or pulling on the leg to get it back into place. Once we get the ankle back in place, then we get x-rays to confirm that it's in place, and then we set the patient up for surgery. In surgery, depending on what's broken, we try to fix the fracture. There could be a fracture of the tibia and also the fracture of the fibula, which is a smaller bone on the outside of the ankle. So if both of them are broken, we are most likely going to fix both of them. There are lots of different ways to fix it. You can use plates and screws. This is a plate here. It's called a 1/3 tubular plate. And this is a plate that we use in surgery to fix the broken bones. These little holes here have slots in them that we can use to put screws. And we put this on the outside of the ankle here and put these screws through these holes, and that will hold the bone in place until it heals. A little bit more advanced is this big plate here. This is a plate that we use in surgery, usually on the femur or the thigh bone. And this plate can hold a number of different screws. We line this up to the bone, we reduce the bone, putting the bones back into place, and then put the plate on until the bone heals. Also, you can put on what's called an external fixator. These are pins and different rods that we put on the outside of the skin, and this will hold the ankle in place until we can take the patient back to surgery. There are different circumstances of when we are not able to operate on the patient kind of right away, whether their skin doesn't allow it, they have lots of blistering, or if their patient is unstable, like they have other things going on, if they fall from a bridge or they're in a car accident and they have problems with their lungs, their kidneys, their heart, and the patient is not very stable to undergo a full surgery, we can put this external fixator, and it's a temporizing device. After surgery, most patients are not able to walk on their extremity if we use a plate or screws, or we can use a metal rod to fix the tibia fracture. Most patients are not able to walk on it for anywhere between 6 to 8 weeks, and it all depends on the patient's medical problems. So this is just to explain kind of Jusuf Nurkic's injury and how we as orthopedic surgeons would fix it. It's a very gruesome injury. It still makes me cringe when I look at videos from such injuries, but I hope you guys enjoyed this video. Thank you for watching, and we'll see you next time.